Cognitive behavioral therapy, commonly known as CBT, is one of the most widely researched and effective treatments for depression. Its core principle is simple yet powerful. The way you think affects the way you feel, and the way you feel affects the way you behave. Depression often traps people in negative cycles that reinforce sadness, hopelessness, and isolation. CBT helps break these cycles by teaching individuals how to identify distorted thinking, challenge harmful beliefs, and replace them with healthier alternatives. It then guides individuals toward positive behavioral changes that strengthen emotional well-being. In this video, we will explore how CBT works, why it's effective, and how it empowers individuals to take control of their mental health. Depression commonly distorts thinking in predictable ways. Individuals may fall into patterns such as all or nothing thinking, where situations are seen as entirely good or entirely bad. They may catastrophize, expecting the worst possible outcome in every scenario. They may overgeneralize, assuming one negative experience means every future experience will be the same. They may personalize situations, blaming themselves for things outside their control. These cognitive distortions shape emotional responses and behaviors. When negative thoughts dominate, emotions become heavier and actions become harder, deepening depression. Cognitive behavioral therapy begins with awareness. The therapist helps individuals identify their automatic thoughts, the quick, often unconscious reactions that appear in response to events. These thoughts are important because they influence emotional reactions. For example, if someone thinks I'm a failure after making a small mistake, they may feel shame and withdraw socially. If someone thinks no one cares about me when a friend doesn't reply immediately, they may feel lonely or rejected. CBT teaches individuals to pause, observe these thoughts, and evaluate whether they are accurate or helpful. Once awareness is established, CBT introduces cognitive restructuring, a process of examining thoughts, questioning assumptions, and replacing distortions with balanced thinking. Instead of "I always mess things up," CBT encourages thoughts like, "I made a mistake, but I can learn from it." Instead of "I'm worthless," individuals learn to acknowledge their strengths and recognize their efforts. Instead of "nothing will improve," CBT helps shift focus to small steps and realistic progress. These balanced thoughts lead to more stable emotions and healthier behaviors. Another core component of CBT is behavioral activation. Depression often causes withdrawal from enjoyable or meaningful activities. This withdrawal reduces positive experiences, reinforcing sadness and fatigue. Behavioral activation helps individuals break this cycle by scheduling activities that create accomplishment, connection, or enjoyment. Even small actions, such as taking a walk, calling a friend, cleaning a room, or practicing a hobby, can improve mood significantly. Behavioral activation teaches that motivation often follows action, not the other way around. CBT also teaches problem-solving skills. Depression can make everyday tasks feel overwhelming. CBT breaks problems into manageable steps, helping individuals develop practical strategies to handle challenges. Whether dealing with workplace stress, relationship issues, or personal goals, CBT encourages structured thinking that increases clarity and confidence. Another essential part of CBT is exposure to difficult emotions or situations. Many people with depression avoid triggers that cause discomfort, conflict, social interactions, responsibilities, or emotional conversations. Avoidance provides temporary relief, but strengthens long-term fear and sadness. CBT helps individuals face these situations gradually and safely. Over time, avoidance decreases and emotional resilience increases. Mindfulness is often integrated into modern CBT. Mindfulness teaches individuals to observe thoughts and emotions without judgment. Instead of reacting impulsively or believing every negative thought, mindfulness encourages space between thought and action. This space provides the opportunity to respond thoughtfully rather than react emotionally. Mindfulness-based CBT is particularly effective for individuals who struggle with rumination, the repetitive cycle of negative thinking that fuels depression. One of the strengths of CBT is its structure. CBT sessions usually follow a clear plan, reviewing progress, discussing challenges, introducing skills, and practicing strategies. Individuals often receive worksheets, journals, or homework assignments to apply CBT skills between sessions. This practical, action-oriented approach helps accelerate progress. It also empowers individuals to continue using CBT tools long after therapy ends. Another key benefit of CBT is that it is time-limited. Unlike some therapies that continue for years, CBT typically lasts between 10 to 20 sessions. This makes it accessible, affordable, and suitable for individuals who want targeted solutions. Despite its shorter duration, CBT produces long-lasting results because it teaches skills that can be applied for life. CBT is also highly adaptable. It can be delivered in person, online, in groups, or individually. It works for children, teenagers, adults, and older adults. It can be combined with medication, used as a standalone treatment, or integrated with other therapies. For individuals with severe depression, CBT provides structure and hope. For those with mild or moderate symptoms, it offers tools to regain control and prevent relapse. It is important to note that CBT does not invalidate emotions. Depression involves real suffering, pain, sadness, fatigue, and hopelessness. CBT does not dismiss these feelings. Instead, it helps individuals understand how thoughts influence emotions, providing ways to reduce suffering and build emotional stability. CBT acknowledges that thoughts are powerful but changeable. CBT also improves communication and relationships. By challenging negative assumptions and thinking more flexibly, individuals become more patient, understanding, and assertive. They learn to express needs clearly and resolve conflicts constructively. This strengthens social support, which is essential for recovery from depression. Finally, CBT empowers individuals. Depression often creates a sense of helplessness. CBT helps individuals reclaim control by showing that change is possible. One thought, one behavior, one small step at a time. Over time, individuals learn that they are capable of influencing their emotions, handling challenges, and building a healthier life. In conclusion, cognitive behavioral therapy is one of the most effective and empowering treatments for depression. It teaches individuals how to understand their thoughts, regulate their emotions, and take meaningful action toward healing. CBT provides practical tools, lasting skills, and a clear roadmap to recovery. Depression may feel overwhelming, but with CBT, individuals can rewrite their inner dialogue, rebuild self-confidence, and regain control over their lives. Changing your thoughts truly can change your life.